So good morning. Thank you, and welcome to Ready, Set, Connect. My name is Samantha Turner, and I'm the Workforce Development Coordinator for the Midlands Education and Business Alliance. This morning, we are about to kick off a webinar series for the week that will feature hot jobs of the future. These are jobs that are going to be in great demand in the next 5 to 7 years. Today's webinar is about careers in healthcare. Joining me is Ms. Keisha Moore with Palmetto Health. Ms. Moore is the RN residency recruiter for Palmetto Health and has an extensive background in working with students and employees to build a career in healthcare. She had to actually step out for just a moment, and she's going to be back and joining us. We just wanted to go ahead and get started. In an effort to improve the quality of this webinar, I have placed all of our participants on mute and ask that you would please stay muted during the presentation. If you have questions, please submit them using the chat box below, and we will answer those accordingly. So at this time, again, Ms. Moore is with us, and I'm going to have her say hello and good morning to everybody.
Hello, good morning everybody. How are you?
And I'm going to turn it over, as we get started, I'm going to turn it over to Ms. Moore, and she's going to just give us an overview of careers in healthcare, those 5 career pathways.
Okay, so I'm just going to go through the 5 career pathways that she just spoke of. The first will be therapeutic services. Those persons who work in therapeutic services work directly with patients providing care, treatment, counseling, and health education information. Those could be anything from athletic trainers, registered nurses, pharmacists, or surgeons, or anything along those lines. The second career path would be diagnostic services. These individuals use tests and evaluations that aid in the detection, diagnosis, and treatment of diseases. These are generally radiologic technologists, nuclear medicine technologists, and pathologists. Third would be health informatics. These individuals manage healthcare agencies as well as manage all of the patient data and information, financial information, and computer applications related to the healthcare processes and procedures. These individuals could be medical assistants, medical records, and health information technicians. Fourth would be support services. These individuals provide therapeutic, healthy, and safe environment for the delivery of healthcare. These are dietitians, nutritionists, medical equipment repairers, health environmental scientists, and fifth would be biotechnology research and development individuals. They study disease and discover new treatments, invent medical devices, used either to assist patients or to improve the accuracy of diagnostic tests. These individuals can be microbiologists, molecular and cellular biologists, and biostatisticians.
Great, thank you. The Health Science Career Cluster is the largest and fastest growing industry in South Carolina as well as the United States. This is a career cluster that promotes health and wellness and diagnosis as well as treat injuries and diseases. Nearly 150,000 people are employed in health science occupations here in South Carolina. So, Ms. Moore, as a recruiter at Palmetto Health, what are some of your greatest workforce needs and careers that you will be hiring for over the next 3 to 5 years?
I specifically recruit for one of the greatest needs we have with Palmetto Health and in the healthcare industry in general is for nurses. We are always looking for well-trained and qualified nurses, new grads as well as experienced nurses. So that's definitely an industry to look into if you are interested in a career in healthcare. I would definitely look into nursing.
Great, thank you. So what do these statistics mean for students who are interested in healthcare? Health science jobs offer high salaries and job security due to the growing demand for healthcare professionals. While the number of doctors is growing, additional booming jobs are those that play supporting roles such as physician assistants, dental hygienists, home health aides, and nurses. We just heard from the 5 career pathways, the array of careers that can be found in healthcare, such as Ms. Moore had mentioned just dietitians and nutritionists. pharmacists, surgeons, all the way up to those real high skill level needs in microbiology, molecular and cellular biologists, biostatisticians. Many health science jobs call for less than 4 years of education after high school. Ms. Moore, for nursing careers, what qualifications are you required to look for at Palmetto Health?
With new graduate nurses for Palmetto Health, we do accept new grads with 2-year and 4-year degrees. We accept both an associate's degree in nursing as well as a bachelor's degree in nursing. Of course, the preference is for a bachelor of science degree in nursing, but we do have a program where if you have achieved your associate's degree in nursing from a 2-year institution, we do offer tuition reimbursement if you wish to pursue that bachelor's degree. So that's a great benefit to our new graduates who come into Palmetto Health, and to encourage you to continue your education after you've already obtained that 2-year degree.
What about above a 4-year degree? Do you encourage some of your nursing staff to get a master's, or is there a certain time where you might require that in nursing?
There are some critical need areas that do require a master's degree, and we offer tuition reimbursement for those critical need areas as well. So definitely we always encourage continued education and growth.
What would be an example of one of those critical needs? Would that be like a nurse manager?
Yes, definitely nurse managers. And the needs change from time to time, so we definitely encourage our nurses who do have those bachelor's degrees who are interested in those critical need areas just to check frequently. Our internal website does let them know what the critical need areas are from time to time, so that if they are interested in pursuing one of those, they can go forth and do so.
Great, thank you. I know nursing comes under that career pathway of therapeutic healthcare, and there's a list here. We have a chart of some of those other career opportunities that fall under therapeutic healthcare. Athletic trainer, you can see we've listed some of the hourly wage information and annual salary information for our students today. The athletic trainer, they have an average salary, an annual salary of around almost $43,000. Physicians and surgeons, an hourly wage of an average about $90 an hour, $187,000 a year. An LPN, on a national average, South Carolina average, we have $19.39 an hour, little over $40,000 a year. And some other healthcare careers that some of your students might be interested in learning more about: respiratory therapists, registered nurse, physician's assistants. What about Palmetto Health? For somebody coming out with a 4-year degree from Clemson or USC, what would be maybe an average salary, starting salary for some of those nurses?
Our starting salary for a new graduate nurse with no experience is going to be around $22-27 an hour. That will get you in the door, also with full benefits, full vacation time from day one. So we do bring you in at a new graduate salary, and that's something that could definitely increase as you stay with Palmetto Health and gain more experience, or if you come in with existing experience. If you've already worked as an LPN, for example, as a licensed practical nurse prior to pursuing your associate's degree in nursing or your bachelor's degree in nursing, then your salary may increase with that type of experience or other related healthcare experience.
Is it different with a 2-year degree, or is the starting salary about the same?
Starting salary for a new graduate nurse is about the same for either a 2-year or a 4-year degree.
Great, thank you. Do we have any questions for Ms. Moore on entry-level nursing, wages, benefit packages? I know Ms. Moore just shared that Palmetto Health does participate in tuition reimbursement. I have heard some other employees at Palmetto Health talk from other areas about cultivating their workforce and helping them to be continuous learners and always looking to hone their skills and increase their level of education. Any questions? You could use the chat box and we could maybe take a moment and answer any questions for you. Okay, we will move on. So, Ms. Moore, what for students who might be interested in pursuing a career in healthcare, what does it take for a career? What kind of skills do you look for?
I think for a career in healthcare across the board, not just for nursing, but just across the board, very important skill set is your interpersonal skills. You need to have good people skills, be able to work well with and get along well with people because that's who you will be working with and servicing on a day-to-day basis. Second would be communication skills. You need to be able to organize your thoughts and ideas effectively and to express them concisely and persuasively when speaking or writing. Um, Third would be teamwork and collaboration. Obviously, you will, again, be providing care to individuals. You will be working with other individuals in healthcare. So you need to be able to work well with others and work professionally with others to provide that good quality care. One that's very important to us at Palmetto Health is integrity. We are always looking for employees that are honest and respectful. We're looking for employees that are compassionate about providing health care and who are very community oriented. So definitely having that compassion for other individuals and for your community is very important to us. We look for individuals who will uphold our company's image and values throughout the community as well as at work. Empathy and understanding of others' cultures and languages and ideas is very important because, of course, in providing healthcare, you're going to come across people from all types of different backgrounds. So you need to be able to be sympathetic and empathetic to those individuals and providing care for them as well. We look for individuals with a positive and professional attitude. These individuals sometimes are in a very bad situation, and of course, when you're not feeling well, you definitely want to be around individuals who are positive, and optimistic and professional and make your day a little bit brighter. So that's definitely a trait that we look for in people in the healthcare industry. We look for individuals who display enthusiasm through words and actions and act in a manner that is responsible, fair, and respectful of others. Um, Lastly would be critical thinking and problem solving skills. Definitely in healthcare is very important. We look for individuals who are able to evaluate a situation effectively and accurately and be able to identify problems and solutions for those situations.
Great, thank you. I know you have an extensive background in helping students. You were previously at Remington College and helped place students in work-based learning activities, and now you're recruiting across South Carolina and working with our higher ed folks from higher education. What is some advice that you would have for students who are interested in healthcare? How can they prepare now, being in high school, even middle school, for careers in healthcare?
Well, definitely, I encourage students, high school students and middle school students, if you are interested in pursuing a career in healthcare, to speak with your parents. Let them help you to find opportunities where you can volunteer. Speak with your advisors and counselors at school. Find out about opportunities where you can volunteer and get involved in the community. A lot of times it's as simple as asking your doctor or your community center how you can contribute. That's definitely a first step. A lot of the schools I know are offering job shadowing experiences. So speak with your counselors at your school about those opportunities. If you know what type of path you're interested in taking or that you think you may be interested in taking, speak with those individuals and find out if they can set up a job shadowing experience for you. A lot of times we think we want to do something until we get in there and start seeing how it really goes. So that's a good way for you to prepare yourself and to make sure what you think you want to do is something that you actually want to do. As you get farther along in school, in high school, and even in college, a lot of times there are internship and externships that may be available to you as well. I'd strongly encourage you to take advantage of those opportunities and think of those opportunities as on the job, or working rather, working interviews, because those are opportunities where you can see how that job that you think you want to do actually works, and where those employers can actually see your work ethic and how you work and can turn into a permanent position, um, if it turns out that way. Um, Additionally is apprenticeships, which is kind of along the same lines of your volunteering and job shadowing. With apprenticeships, you're able to go in, see how everything works, and to learn from other individuals who have a great deal of experience in that area. There are different summer camps and things that may be available along the career path that you're looking into. That's something that you can speak with your representatives from school, speak with your parents about, so that they can research, and use your resources such as MEBA to find out what camps may be available in the healthcare industry. The HOSA organization is definitely a great organization to be a part of. You want to participate as much as possible in those types of organizations at school, and in your community, so that you can continue to network and to gain useful experience that's going to help you in the long run. Um, and then definitely, if you have the opportunity to pursue some type of employment in healthcare, even if it's at an entry level, those types of things always help. They always help you to build your resume and to get comfortable in the healthcare culture, so that when you do pursue your career, you already have that experience. Certifications and credentials in the industry are definitely important, depending on what your career path is. There are different certifications for those, for pretty much any career in healthcare that you would want to pursue. Whether a 2-year or a 4-year institution is best for you, find which one is best for you and what opportunities may fall in line with your desires for a career in healthcare, and definitely take advantage of those opportunities to continue your education. The healthcare industry is a growing industry with a growing need, and those needs are constantly changing, so education is very important. And last but definitely not least, you want to make good choices, especially when you have a desire to pursue a career in healthcare. This is an industry where you will be working for and providing care for individuals, so you want to make good choices as far as the people who you are around, the decisions you make, and the things that you do, because there are different things that you'll have to do to get into the healthcare field. We do look at things like your background check. We look at things like your education and your grades. So we want to make sure that the decisions that you make early on don't make you suffer later on in life, if you do desire to pursue a career that, like healthcare, that will look back at those things.
Great, thank you. One question, with you visiting our colleges and universities across South Carolina, is there a process? What does the application process look for students who are getting ready to graduate? Do they start that application process after graduation, or what do you recommend for the most effective and efficient transition application process?
If you are pursuing a career in healthcare, specifically, for example, nursing, or really any area of healthcare, I definitely do not recommend that you wait until after you graduate to start looking. I always tell the senior nursing students who I go speak with, isn't it going to be relieving if you can go home for Christmas, for example, knowing you already have a job and you don't have to come back after graduation and start looking for something? So it definitely takes a weight off your shoulders, but more importantly, while there are a lot of jobs out there, they're definitely very selective, because we do want the best of the best. So you want to get in there early and get that opportunity early to make your impression. We generally typically open up our applications several months out. For our December graduates, we started accepting applications back in October and started interviewing at that point. So you want to, I'd say typically about 2 to 3 months prior to graduating, go ahead and start getting your applications out there, start interviewing for those positions, making decisions about where you might want to go or what you might want to do. Um, Trying to get your interviews in early. Definitely pay attention to the requirements for the position you're applying for. For example, with the new graduate program at Palmetto Health for nurses, we do look at your references. We need 3 clinical references, as well as a personal reference and an unofficial copy of your transcript. So you want to go ahead and again, make good choices, make good impressions on your clinical instructors, and get with them early in the application process. get them that clinical reference form so that they can be getting that back in for you, so that doesn't delay you getting into the residency program or into the position that you're looking for. But you typically want to get that application in early, and then we can get you cycled through the application process. There are a couple of interviews that you'll participate in, as well as other opportunities that may be available, from open houses. Um, there may be job shadowing opportunities available to you, touring opportunities available to you, but the earlier you get your applications in, the more opportunities you have to expose yourself to those.
Great advice. Thank you. Any questions for Miss Moore? We've come to just about the end of time here, and we do have some time for questions while we have this expert speaker here from the health science industry. Anybody have any questions for Miss Moore? Any student questions? Okay. Well, we have just a few more minutes, so if any questions come up, please submit them through the chat box below. But I would like to just thank you for participating and connecting with MEBA today to learn more about the careers in healthcare. MEBA has made it possible for our constituents to connect with us in many ways. We encourage you to follow us through the many avenues of social media, Twitter, Facebook, LinkedIn, YouTube, and Pinterest. I will upload our presentation from today up onto YouTube, and it will be available through a link on our homepage. Please connect with us again tomorrow as we learn about careers in science, technology, engineering, and mathematics, as well as a new tool for students to use in the college and career planning process called STEM Premier. Again, do we have any questions? Okay, well, I'd just like to take a moment to thank Ms. Keisha Moore from Palmetto Health for being our guest speaker today and providing us with her expertise and background in healthcare. Ms. Moore is a MEBA business partner and has been for several years now, and she's also on our MEBA Speakers Guide if you would wish to connect with her further. Anyway, we look forward to connecting with you again. Thank you and have a great day.